How to overcome alcohol addiction. Alcoholism is when one can no longer control their use of alcohol or compulsively abuse alcohol. Despite its negative ramifications and experience emotional distress when they are not drinking. Short and long-term physical effects associated with alcohol addiction can include heart problems like 1. Cardiomyopathy. It means enlarged, inefficient heart muscle. 2. Arrhythmias, irregular heartbeat. 3. High blood pressure and stroke. Liver disease, including 1. Steatosis, fatty liver. 2. Alcoholic hepatitis. 3. Fibrosis and cirrhosis. 4. Hepatocellular carcinoma. Pancreatic problems like 1. Pancreatitis. It is an acutely painful inflammatory condition that can progress to a chronic disease. Pancreatitis can affect a range of pancreatic functions, including the normal release of digestive enzymes. Certain types of cancer, including 1. Head and neck cancer. 2. Esophageal cancer. 3. Liver cancer. 4. Breast cancer. 5. Colorectal cancer. And another physical problem is a weakened immune system. In alcoholics, their immune system can be weakened. Weakened immune system can increase your risk of infection and contraction of diseases like pneumonia and tuberculosis. Then potential short and long-term psychological and cognitive effects associated with alcoholism include 1. Cognitive problems, such as memory loss or problems in thinking clearly. 2. Blackouts. Periods of time in which you cannot recall events. 3. Serious brain damage and disorders like Wernicke-Korsakoff syndrome, which leads to confusion, impaired optic nerve function, profound movement deficits, and problems with memory recall and consolidation. 4. Mood disorders, like major depressive disorder or bipolar disorder. 5. Anxiety disorders, especially panic disorder and social phobia. So you should overcome your alcohol addiction for your better future. But pain, anger and frustration often surround the struggle with alcoholism. Maybe you've tried to overcome your addiction, but have relapsed and feel like giving up. Words like relapse prevention techniques, coping mechanisms, detoxification systems and support groups may feel abrasive at this point. Perhaps you're realizing for the first time that you might struggle with alcohol and have no idea how to overcome it. It can be difficult staying motivated to overcome alcoholism, yet change is possible. There are 11 steps you should follow for 21 days. These steps can help you to overcome your alcohol addiction. 1. Making a list of the reasons to reduce your drinking, such as feeling healthier, sleeping better, or improving your relationships. And prepare the list with your own handwriting. It can motivate you to overcome your addiction. 2. Set a drinking goal. Set a limit on how much you will drink. You should keep your drinking below the recommended guidelines. No more than 1 standard drink per day for women, and for men ages 65 and older. And no more than 2 standard drinks per day for men under 65. These limits may be too high for people who have certain medical conditions. Or for some older adults. Your doctor can help you determine what is right for you. 3. Keep a diary of your drinking. For 3 to 4 weeks, keep track of every time you have a drink. Include information about what and how much you drank as well as where you were. Compare this to your goal. If you are having trouble sticking to your goal, discuss it with your doctor or another health professional. 4. Don't keep alcohol in your house. Having no alcohol at home can help limit your drinking. 5. Drink slowly. Sip your drink and drink soda, water, or juice after having an alcoholic beverage. Never drink on an empty stomach. 6. Choose alcohol-free days. Decide not to drink a day or 2 each week. You may want to abstain for a week or a month to see how you feel physically and emotionally without alcohol in your life. Taking a break from alcohol can be a good way to start drinking less. 7. Watch for peer pressure. Practice ways to say no politely. You do not have to drink just because others are. And you shouldn't feel obligated to accept every drink you are offered. Stay away from people who encourage you to drink. 8. Keep busy. Take a walk, play sports, go out to eat, or catch a movie. When you are at home, pick up a new hobby or revisit an old one. Painting, board games, playing a musical instrument, woodworking. These and other activities are great alternatives to drinking. 9. Ask for support. Cutting down on your drinking may not always be easy. Let friends and family members know that you need their support. Your doctor, counselor, or therapist may also be able to offer help. 10. Guard against temptation. Steer clear of people and places that make you want to drink. If you associate drinking with certain events, such as holidays or vacations, develop a plan for managing them in advance. Monitor your feelings. When you are worried, lonely, or angry, you may be tempted to reach for a drink. Try to cultivate new healthy ways to cope with stress. 11. Be persistent. Most people who successfully cut down or stop drinking altogether do so only after several attempts. You will probably have setbacks, but don't let them keep you from reaching your long-term goal. There's really no final endpoint, as the process usually requires ongoing effort. If you follow these steps, you can overcome your alcohol addiction.